We have our update this week of the COVID-19. Kathy and Jamie will be taking us through that.
Thank you. Good morning, Mr. Chair, Commissioners. I just handed out the case information. So in Clay County, our confirmed cases are 1,756, 1,756. 19 of those are newly reported cases. We had an additional death, so we're now at 42. And you can see on the second page on the back, we still have all of the dates, cases in Clay County. So, clearly in September and October, we've seen increases in cases, and then increases in the active cases. Now we're at 227. They've been kind of in the 200 range for September and October, and we've talked about those increases with the higher ed and the schools and gatherings. Our 14-day case rate also increased. That's the rate that that's the 14-day case rate per 10,000 people. That's the rate that we share with the school districts. They use that as one of the data sources to determine whether what their distance, whether they'll have distance learning, hybrid, or in-person. That's just one of the data sources. They also have to determine their staffing, if they have enough teachers and subs, how many kids are positive in their school districts, how many teachers are positive. So it's just one of the data sources that they use, and we meet with them weekly to kind of talk through what is happening. And sometimes they'll call us if they have questions about should they hold this particular sporting event, if they have a positive case, and those kinds of things. So we work with the school districts pretty closely on their decisions about distance learning. So that 46.6 is up there, but the recommendation was that they continue their learning modules as they currently are doing, and then we'll just look at the next rate. So we'll have a different rate on Thursday, and so we'll see what that rate is, and then determine their needs with how they're providing their learning. It's challenging for them because they have, when they're impacted with the teachers, that's a real hardship for them to determine how they're going to provide that learning.
Excuse me,
go ahead.
Our increased rate, now, is not because of more testing, I don't think, the way it sounds. It's just because there's more people are getting it, though, aren't there?
It's the combination. So we continue to do testing, and we want to continue to keep doing testing so we can provide the mitigation strategies. Because if you stop the testing, then you're not able to catch. Sometimes we can catch people when they're even asymptomatic,
right,
and hope to stop the spread, slow it down at least a little bit.
But there's no mass testing going on right now, is there?
Well, we just had that previous mass testing event at the National Guard and the Armory, and then Jamie will talk about some other testing that will come up. So I'll let her talk about that. But yeah, currently, right now, no, there isn't a mass testing site.
Okay.
So, and then Minnesota confirmed cases are at 113,000. So, Minnesota has continued to see some increased cases and some increases in hospitalizations in ICU. In Minnesota hospitals, they aren't at their max capacity. They have ability to have more COVID cases, but they certainly have seen a ramp up. Our hospitals on the North Dakota side have also seen a bit of an increase, but they still have the ability to expand beds as they need to. Staffing might be the issue for them, is just finding appropriate staffing if they have to expand beds for COVID cases. So right now they're able to manage the cases that they have. But certainly as we see how significant the numbers are in North Dakota and how high those rates are, there's certainly that concern because we're seeing the numbers ramp up. North Dakota is in a worse spot than Minnesota for the cases. So we're seeing it around North Dakota, South Dakota, and I believe Iowa. There's some states that are really ramping up to become pretty significant areas to be concerned. So Minnesota, it's not that we aren't concerned, but we aren't seeing that huge ramp up that they are. We just have to be very conscientious when we talk about the things that we know right now is wearing your mask when you're in gatherings and eliminating those large gatherings and not being masked. So, those are mitigation strategies. Staying 6 foot away from people in less than 15 minutes. And, of course, the hand hygiene. And you think about the only things we have right now are those measures until we get that COVID vaccine. And, you noticed today on the national news, there's a little delay in one of those. We have weekly meetings with Minnesota Department of Health about when it comes and how it may come and how we may distribute that. So we're still in conversations about that because there's a lot of unknowns from the CDC. So until the COVID vaccine comes and we can get the large community vaccinated, we still only have these measures to prevent the spread. We really want to stress that it's important to get your influenza vaccine. I know that all of you have had that, so that's great. We really encourage the public, get it now. It's a good time. It's October. It's good to get it now to be vaccinated against influenza. That doesn't protect you from COVID. So, and we want people to get it sooner than later. So we're hoping people take advantage of the opportunities. There's plenty of opportunities to get the influenza vaccine. Healthcare systems have it. Pharmacies have it. And so there's opportunities to get that. So now's the time.
When you say it does prevent against COVID, this flu vaccine right now, I mean, the flu vaccine that we got, did that just prevent you against one certain type of flu? That's it?
It will protect you from influenza virus, which is completely different than the COVID virus.
Oh, it's completely different, okay.
Right, it's a virus. They're both viruses, but the influenza virus, so they match that up and they work on that for a whole year, and they protect you against the worst strain. That doesn't mean that some people might get a mild strain of influenza, but it should protect you from the worst strain, the one that will cause hospitalizations, deaths. So it's important to get that. They're really concerned if people have influenza virus and the COVID virus at the same time. How will that affect your body? It would be a pretty significant hit on the system. So that's the reason they're really pushing the influenza vaccine, so you can at least be mostly protected from that virus when the COVID virus comes around. And we hope a lot of people will take advantage of that when we see that vaccine. So more to come on that. Any questions on some of the numbers, or the back page shows we still have a large number of cases in that 18 to 22-year-old range. That's our highest. And then, of course, the 30 to 39, that's the second highest. So we're seeing the numbers in maybe the younger folks. Our long-term care seems to be, that was a big hit when we first started with COVID, but it is not the highest numbers right now.
Mr. Chair.
Yeah.
A question. Kathy, I appreciate the numbers and know that I've said it's helpful to see trends. I know that the schools are tracking the Cass County numbers as well, just so that they can get a broader picture. Is there any way that we could get that case positivity just included? I don't need all the data, but just included in ours so we can kind of see the whole picture. Add it to this.
You're asking about the school rate?
Just add the Cass County case positivity rates so we can see what they're trending at.
The Cass County rate?
Correct.
Oh, okay,
Is that
sure.
possible to add?
Yeah, I can probably get that. We've talked about why we can't provide we can provide a Clay County positivity rate, but it's not accurate because of the negative test results that we do not get. So it's based on all tests. So
right, and I guess that's my point, is if we can't, for whatever reason, people are doctoring in North Dakota, get that, it just helps us to see the whole metro.
Yeah.
So are you talking about the Kathy, are you talking about the 7-day positivity rate, or are you also referring to they're doing the 14-day?
I think the 14-day case rate per 10,000 people is
Okay.
helpful if that's available.
Yeah, I can check with Fargo and see if we can get those, the Cass County rates.
My other question is, I know that we've been careful not to release positive cases by location. It's just county as a whole. As we move forward to addressing these maybe micro pockets of positive cases, is that something that public health is doing to address those pockets before they leak out into the community on a larger scale?
Yeah, we certainly can get a lot of the information off of our system that provides all the positive cases. So we can, our case investigators and contact tracers can alert us if there's kind of a hot spot,
Right.
particularly in a community.
But are we doing anything to mitigate the hotspot?
Other than the follow-up, so the case investigators and contact tracers are following up on all of those cases. What they're seeing currently with the data is it's really associated, so much of it is associated to the social gatherings. So providing that information again in the education about, trying to keep away from the large group gatherings, and especially when they're not masking and if they're indoors. Outdoors, there's a little bit more protection and an ability to social distance, but indoors and large gatherings is seemingly our problem at this point.
Okay. So then, to further on that is, are the schools alerted as to neighborhood hotspots? And part of how I ask this is to allow us to have all the tools necessary to make the decision that would help to slow this, or.
Yeah, the schools are alerted only to their cases that they have with their staff and students. So we aren't alerting the schools if there's a particular hotspot in a community, as we're not allowed to. But the schools are really monitoring their hotspots, and their hotspots would be really all of their students that are positive and quarantined and all of their staff.
And I just think that would probably be helpful to know, for instance, one of our rural schools, if there is a hotspot in one of those neighborhoods, they're less likely to allow kids back into the classroom. Or on the flip side, if the hotspot does not include that community, that would change their trajectory as well.
Their guidance is to really just look at their students and staff. That is their guidance from MDH. So looking at how many students you have out, how many staff you have out, how many positives and how many quarantines. So that's their data that they're looking at. And then of course the whole county rate, but not specific to the city.
Well, I know that MDH doesn't take marching orders from really anybody, specifically a commissioner in Clay County, but I definitely feel like that is a gap that would, that information would help a lot of different cases, for sure.
I know the schools expressed concern about the information going out about a hotspot in their particular school. They do not want that to be public information. So I'm bringing that back to MDH to.
Well, I'm not saying that I want to publicly do it, but I
Right.
think between public health and the administration, you surely could alert them.
You know, I would like to add that Kathy is hosting weekly meetings with the superintendents from the schools, and so that is an opportunity for them to share.
Okay.
There was a meeting yesterday that was an additional meeting that had to do with some issues that they wanted to discuss. So she's hosting those meetings locally and giving them the opportunity to share as well.
And that's just the superintendents on
Right.
those calls, so.
Okay, thanks.
Yeah. Any other questions? I'll let Jamie talk then about.
Okay, I'm going to start with just to highlight a few of the things that Kathy pointed out. Testing was one. Kathy announced last week that Clay County has been identified as a semi-permanent testing site. So when you talked about testing in the community, it's coming. We don't have a location yet. We have another planning meeting today. The hope is by Minnesota Department of Health that they will be ready to go this weekend even. Kathy talked about that this is a private company that is going to manage all the staffing. It won't have an impact on our staff, but it will provide an opportunity across our region for testing in the community. They will be doing the test at no cost. They're using funding, the state is using funding to support that, but they will bill insurance if a person has the ability to bill the insurance, but there wouldn't be a bill back to that person at all. So that will increase the opportunity for testing. We talked last week, as you know, our providers have been able to do testing. Sanford's, Essentia, and Family Healthcare have provided testing for those that have symptoms or have been a close contact. In our region, we've heard some discussion about close contacts due to the number of people that are symptomatic. They're having trouble getting tested for close contacts. So that will provide an opportunity in our community as well. The other thing is Kathy talked about the vaccine, and so there's a lot of planning going on at the federal and the state and the local level for the COVID vaccine. It seems to change daily, so we had a meeting yesterday that talked about how it will roll out and who will be the first provided with the vaccine is all to be determined, but it's a daily issue and priority for us in public health. Hotspots. You talked a little bit about hotspots, and our behind the scenes of our case investigators, there's an actual team at the State Health Department, and those teams focus on corrections, and they focus on higher ed, they focus on K-12, they focus on long-term care. So part of what's happening behind the scenes as well is when there's a hot spot, then the Minnesota Department of Health team is providing resources to get on top of those hot spots. And a hot spot is, I believe it's 5 cases. And so there is a lot of attention drawn to hot spots in the community. Locally, what we do is that with our partners that we're working with throughout the community, whether it's higher ed, K-12, businesses, they're contacting local public health. So before that case is in the system at the state level, we start working with them to help them to figure out who those contacts would be. So again, we're working at the local level to try to get on top of those hot spots. Like Kathy mentioned, the cases that we have, we can't necessarily, all the data is not always there, so we may not know that it's all in the same address kind of thing, unless it's identified as a, like a long-term care facility, or if it's housing at a university. But locally, we're working with all of those people to try to get on top of those cases. So the next thing I usually try to do is highlight any new guidance that came out from Minnesota Department of Health. Minnesota Department of Health developed some new guidance to align with CMS, Center for Medicare and Medicaid, for long-term care visitation and activities guidance for them. So basically what they're doing is, as we're trying to balance COVID in the community with visitation and going into fall and outdoor visits being less likely, there's a lot of focus on long-term care and our assisted livings. We have quite a few providers of assisted living and a lot served in our community. So what they're looking at in that new guidance is that if the cases if they're free of a case for 14 days, so they're shortening up the time frame, then visitation would be possible. They're also looking at the community rate. So looking at the community spread is an important part of that, the positivity rate. Medicare and Medicaid are using a 14-day rate, and they are actually going with a color. Right now, Clay County is in the yellow, which means that their staff are required to be tested weekly. So it's the Center for Medicare and Medicaid in long-term care is requiring testing of that's just our nursing homes, based on the number of cases in their facility, but also based on the number of cases in the community, that positivity rate. Minnesota is doing basically if they're at a high, which is greater than 10, then they cannot have visits. And we, in Clay County, we're sitting at about, I think it's 6%. Again, that's high for us because of our testing in North Dakota that we've talked about. So the goal is that if we can continue to work on community spread, because community spread is what is challenging our long-term care facilities and our assisted living. But they are dependent on community spread, which means the positivity rate in our community being down for them to continue to have visitation for those that are living in our facilities. Minnesota Department of Health also put out, and that is effective October 1st. That guidance is effective October 1st. Minnesota Department of Health also put out new guidance on temporary tent structures and then clear division, kind of like the plexiglass thing to allow for visitation indoors as well. So that's all I have.
I've just been interested on kids, children in schools that get the COVID-19. Do we track at all where they get it from? I mean, you would think if one kid has the whole school is going to get it, but where do they get it from? Their parents, or don't we track anything like that? Where do the children mostly get their contact from?
Yeah, our case investigators and contact tracers are finding that the majority of those cases are coming from their social gatherings. So when they're getting together at home or with other kids, it is not, there's very few, if any, that are contracting it from the schools. So they're really getting it with their social gatherings.
It's outside of the schools.
Correct. Outside of the schools is the majority of the spread. They're going out to eat, they're getting together, that's where the majority of the spread is.
Okay.
Part of what, when I said Kathy's hosting those weekly conversations, they're learning from each other too. So like one thing that was discussed recently was locker rooms. Some of the schools are using locker rooms, some are not. So they're, when they identify a hot spot or a priority, they discuss it and they share that. But really they're doing a great job in terms of the social distancing. And when we work with them, there are not a lot of quarantines that are coming out of a positive case in the school. It's more the community contact that's been a challenge for them.
Okay. Any questions? Kevin, do you have anything?
No, thank you.
Okay. All right.
Okay, thank you.
Thank you.
Thank you.